Welcome to AFMC TV. I'm Robin Ledbetter.
The goal of that is to maximize people's quality of life, right?
You want to make sure that your housing is affordable in your community.
We have to think about vaccines in a way that we haven't thought about them before.
I had a lot of the legislative adults who were very creative.
Down on the floor and play with their kids.
AFMC TV. Thanks for watching. Have a great day. Welcome to AFMC TV. I'm Robin Ledbetter. Thank you for joining us. Today I have with me Dr. Matthew Feldner. He is a licensed clinical psychologist and the director of the Arkansas Clinic for Stress and Anxiety. Dr. Feldner, thanks so much for being here.
Well, thanks for having me. I've been looking forward to this opportunity to talk a little bit more about this area.
So can you briefly describe your work and how it connects to stress and burnout in today's healthcare workforce?
Yeah, so in short, I've been doing work for about 25 years on anxiety and stress, the techniques and strategies we can use to reduce anxiety and stress, using a pretty wide variety of methods to both try managing anxiety and stress reactions and also to elicit those kinds of reactions and measure anxiety and stress in response to those elicitations. And one way to think about this is it's working with psychological or psychophysiological arousal, and how can we understand how to reduce that arousal? And when we're talking about stress, we're really talking a lot about the arousal, the physiological, the neurobiological arousal that's triggered by stressors. And so my work really helps shed some light on some of the things that we can do to manage that arousal in the face of stressors.
And what is neurowellness? How should healthcare professionals think about it in a clinical setting?
Yeah, it's a good question. As I understand it, neurowellness is intentionally engaging in activities that promote our neurobiology or our neurobiological systems for managing stress and managing anxiety. So some of this really overlaps with what we've been doing in this area of clinical psychology for quite some time. So using strategies, for instance, like cognitive restructuring, which is a technique for sort of being intentional about how we interpret things that happen in a way that helps us, helps reduce the reactions to those things, and then also helps sort of helps us cope with those different events. And so what neurowellness brings to that picture is, in addition to the short-term value of engaging in different therapeutic techniques like cognitive restructuring, there also is a long-term or a long game here that can be really helpful to think about. So for example, cognitive flexibility, cognitive restructuring, we've learned a lot about the neurobiology underlying that technique. And we've also seen now repeatedly in the literature that participating in cognitive behavioral therapy changes the structure and the function of our brain systems involved in this technique of cognitive restructuring. And so the more we know about the plasticity of the brain and the way the brain reacts to the regular use of these kinds of techniques, the more we're able to capitalize on that and think of using these techniques not just for managing acute stress or acute anxious reactions, but actually as strategies for improving our ability long-term to manage these reactions as they occur naturally. We all, I don't need to say this to anybody listening to this, I don't think, but we all encounter stressors, and anxiety comes up from time to time. These are normal, natural, adaptive reactions. And so what neurowellness offers is using these techniques regularly to strengthen the neural circuitry that helps us react in an adaptive and healthy way to these stressors that are naturally going to come up. It's almost like workouts for the brain in some ways. If you practice these things, even when you don't need it, they're going to be more helpful when you do need it.
Mm. And this is different from traditional approaches to mental health or burnout.
The way I see it being different is really that long-term aspect of it. You know, for quite some time, we've been focused on the short term. If you're, struggling with anxiety, here are some techniques like cognitive restructuring that can help you manage the anxiety when it comes up, or maybe even prevent the anxiety in a certain situation. The neurowellness piece differs in that it offers us this idea that we're also strengthening the sort of muscles or the neurocircuitry behind these activities. So practice it even when you don't need it, because it can help in the future when you do. And that's really, I think, what neurowellness shines a light on in a really helpful way.
And what are you seeing that's happening in the brain and nervous system when clinicians experience chronic stress?
Yeah, that's a good question with a very complicated answer. The stress reactions have effects genetically. They have effects at that neuronal level. They have effects all throughout the body. And so the way I think about it in my practice and in some of the work that I do is the stress reaction involves arousal. And this goes back to sort of the links with my work, that a normal, natural, adaptive reaction to a stressor is the body sort of recruits resources, increases arousal so that we can manage this stress. And then under typical sort of healthy conditions, that stress goes down, that stressor goes down after we've managed it, and then our body can relax again and recuperate, sort of in some ways almost refuel, recharge a little bit. And so it's that arousal that's key when understanding stress reactions, and also when understanding how do we manage it. How do we manage traumatic or extreme stress? How do we manage chronic stress and help prevent burnout that can follow from long-term chronic stress? A way to think about it is it's about that arousal. It's about that psychophysiological arousal and tamping that back down. And so that's the element of the brain response that I think is most helpful to highlight in the work that I do.
And that does impact decision-making, communication, and even patient care?
It does. It absolutely does it in multiple ways. So to a certain degree, stress can be really helpful. It can help us perform at our best. In some ways, that arousal keeps us on our toes. It keeps us alert. It helps us manage a challenge. Maybe it's an urgent situation with a patient. We become really aroused, we're focused, we're ready to go, the energy level is high. And so to a certain degree, that stress can be helpful. But it's when that stress becomes chronic, or when we can't sort of relax afterwards, when we can't downregulate that arousal, that stress becomes a problem and can start impairing our ability to perform. And it can do so in a number of ways. So for example, with burnout, which is essentially the way I think about it, not having much of an opportunity to bring that arousal down because the stress is so chronic, our body starts to downshift in some ways. And that's what we experience as burnout, which can include symptoms of depression and exhaustion and anxiety. So when we're working with patients and we want to be at our best and we want to have those energy levels that allow us to best provide care, and we don't want to struggle with the biases in thinking that can come with anxiety and depression, it's there where the chronic stress can really impair our ability to work well with patients and to provide the best care that we can.
Is there evidence-informed techniques that healthcare professionals can use during the workday? Or it doesn't even have to be a healthcare professional, anyone that could use techniques that they could use during the day?
There are. One general way I think about this is anything that can help bring that arousal down can be helpful for managing stress. And so for any given person, an infinite number of things may be helpful, as long as it's bringing that arousal down. So first, that's not playing an exciting video game. That may distract us from the stressor, but it's not bringing the arousal down. We're excited we're playing this video game, right? But something like reading or fishing or just having some quiet time away from the kids and away from work can help. Now, you asked about evidence-based approaches, and there are those too. two strategies that have been in the cognitive behavioral literature and have received a lot of support over the years are deep diaphragmatic breathing, where you just essentially create a quiet, distraction-free environment and intentionally focus on taking deep breaths using your diaphragm. That can be very relaxing, can help reduce anxiety and reduce perceived stress. A second one with quite a bit of evidence is progressive muscle relaxation. This one's a little bit more helpful for reducing muscle tension. And it's a little bit more involved, but essentially it involves the tensing, short-term tensing, and then tension relaxation of muscle groups throughout the body. So by the end of running through your muscle groups, you've significantly reduced that muscle tension that can be a consequence of stress or chronic stress. And so those two have quite a bit of evidence, with mindfulness meditation being another one that's getting increasing amounts of evidence in support of it as a stress management strategy.
How can organizations support this without adding more burden to staff?
I think there's a couple of ways that organizations can, at least a couple of areas they can focus their efforts. So one thing that we know about stress is when people experience a stressor as out of their control, it has a more significant impact. Out of control events are more stressful. And so one area organizations may benefit from focusing on is trying to help their employees feel more sense of control over their work stress. And that may look something like giving them a little bit more involvement in policy making, making sure they're represented in creating different policies, or taking into consideration their requests and their needs when it comes to scheduling, giving them a little bit more control over that. Another one that I think healthcare organizations could consider is predictability. When stressors are not predictable, they have a larger impact. And so doing everything they can, and I realize working in healthcare, not everything is predictable, and that there is a certain stressful nature to working in healthcare. However, if we can increase that predictability, it may have real benefits for people, for reducing the stress that they experience. And it may be predictability in terms of their schedule, predictability in terms of their client load, predictability in terms of changes that might be coming to their duties or their work environment, but trying to increase predictability whenever possible. There's some other options that may involve some investment on the part of organizations as well. Trying to make available to healthcare providers some training like we're talking about here, training in deep diaphragmatic breathing, for example, or perhaps investing in making stress-reducing activities available to healthcare providers. So yoga classes, for example, they require an investment, but given better outcomes that can come from less burnt out care providers, that investment may ultimately pay off down the road.
And those translate to better outcomes for both the provider and the patient.
Exactly right. Reducing that chronic stress and that burnout is certainly going to help providers with their psychological and their physical health. We've known for a long time that chronic stress has a number of really significant negative impacts on things like obesity and weight gain, things like immune system functioning, and of course, depression and anxiety and substance use problems and a whole number of mental health conditions. And so investing in managing stress, helping people bring that stress-related arousal down to prevent burnout is going to certainly improve outcomes for patients, for providers, and therefore it's going to help those providers provide better care to patients and improve patient outcomes that way too. People will be less distracted, for example, when they're less burnt out. They'll have more energy levels, the kinds of things we were talking about a minute ago, where they will be able to provide better care, resulting in better outcomes for their patients.
So what's one realistic first step that a healthcare organization can take to integrate this approach?
I would say a realistic step is for the organization to learn some of these strategies, learn how to do them, learn how to teach them, and then offer it to their providers. So for example, someone from the organization learns deep diaphragmatic breathing, receives some training in how to administer that technique, and then teaches the providers to do it. Low cost, pretty easy to administer, and would demonstrate an interest in providers' psychological well-being and in their physical health, and could certainly be a first step towards trying to reduce burnout and reduce chronic stress for their providers.
So before we go, what's one takeaway that you'd want a healthcare professional and audience watching to apply this week?
So if I would say one thing, it actually takes a step back. And that is, most of us here were familiar with the fact that learning about healthy activities, talking about healthy activities, is relatively little. We've got to do those things to get the benefits from them. So here we've been talking about some ways to reduce stress. We've been talking about, ways to prevent burnout. A first step getting there, I would say this week, would be to come up with a very specific, very realistic plan and a start date for when that plan begins for integrating these techniques into our lives. So for example, daily, how can a person just insert 5 minutes of arousal reduction into their day? Is it 5 minutes at the front end of a lunch period? Is it 15 minutes at the end of a workday? Just a brief opportunity to be very intentional about reducing that stress from the day, reducing that arousal. Is there any way to protect a little bit larger time period during the week? Maybe it's 2 hours on a Saturday. These 2 hours are for me to do something that's relaxing, that helps me reduce arousal. But having a realistic plan and then setting a time when that begins are useful ways to get this started, to turn a plan into action. And so I would start there.
Well, great information. Dr. Feldner, thank you so much for being here today and sharing your perspective and really great insight into this neurowellness and ways that healthcare professionals can really have some great takeaways. Thank you so much.
It's been my pleasure. Thank you for having me.
And that's it for this episode of AFMC TV. Thanks for watching and have a great day.